In this video, let us discuss about the normal heart sounds. Normal heart sounds are basically divided into two, S1 and S2. S1 is due to the closure of atrioventricular valves, tricuspid valve and mitral valve. These two valves closes, avoiding the reverse flow of blood from the ventricles due to contraction. This generates a sound which is S1, the first heart sound. S2. S2 is called as the second heart sound, and this sound is generated due to the closure of semilunar valves, the pulmonary valve and the aortic valve. Once the systolic contraction is complete, the blood flows out of the heart, which will tend to return back. This closure of valves avoids that. Let us hear the sounds. These two sounds are lub and dub. This is how the first sound S1 and S2 appears. Let us discuss about the third heart sound. The third heart sound S3 appears at a delay of 0.1 seconds after S2, which is very subtle. Let us hear the sound. This is how S3 appears, and this is caused due to the rapid flow of blood into the ventricles. When they tend to fill the ventricles, the chordae tendineae, the muscles starts to expand, and this is normal in young patients. But this S3 is not normal for adult patients or older patients due to the heart failure or stiffness of these chordae tendineae muscles, which becomes weaker for the older patients. This S3 does not appear normally for older patients, and it can be heard as lub-de-dub, lub-de-dub. This is how the sound is heard. Let us hear it again. Now, did you hear the difference between them? Now let us discuss about the fourth heart sound, S4. This S4 appears slightly before S1, and it is always abnormal, and it is relatively rare, and this is due to the stiffness of the same chordae tendineae muscles, and it is called as hypertrophic ventricles, and this is due to the flow of bloods into the ventricles and hitting the walls. This is called as the turbulent flow of the blood. This fourth heart sound here just before the S1 can be considered as li, lub, dub. Let's hear it. Now let us discuss about oscillation. The flow of blood and the heart sounds can be heard using stethoscope. In stethoscope, there are two directions. One position is the bell curve and the other is the diaphragm. Bell is used to hear the low pitched sounds and the diaphragm is used to hear the high pitched sounds.